Welcome, everyone, to our report of main findings from the 2020 Kessler Foundation National Employment and Disability Survey, Recent College Graduates. I'm Elaine Katz, Senior Vice President of Grants at Kessler Foundation. Also presenting today is Dr. John O'Neill, Director of Employment and Disability Research, also at Kessler Foundation. Kessler Foundation is located in East Hanover, New Jersey, and we change the lives of people with disabilities through medical rehabilitation research and funding employment initiatives for individuals with disabilities. Our rehabilitation research seeks to improve cognition and mobility for individuals with disabilities such as stroke, spinal cord injury, traumatic brain injury, and multiple sclerosis. We also look to improve daily functioning and independence by testing new interventions and gathering data that can be used in treatment. Our Center for Grantmaking has invested close to $49 million over the past 13 years through our 3 grant programs in New Jersey and nationally. Our targeted grantmaking has supported new business ventures, job training and job creation in various sectors and industries, but most importantly, we are the leading funder of innovative approaches that can affect systematic change by creating genuine economic opportunities for people with disabilities. Also joining us today is Annemarie Veira, Coordinator for Disability Resources at the School of Visual Arts in New York City, and Adjunct Lecturer in the Department of Education Foundations and Counseling at Hunter College. And now I'm going to turn it over to John O'Neill, who's going to start talking about our survey. Thank you for joining us today.
This is a study of recent college graduates that grew up during the ADA. It was the 30th anniversary, and the Kessler Foundation wanted to celebrate that anniversary with a survey of recent college graduates, that is, college graduates who individuals who grew up under the ADA and graduated from college and had the experience of ADA legislation as a background. Next slide. Since 1996, there's been quite an increase in the proportion of individuals with disabilities who are taking part in college. In 1995 and 96, there were only 6% of the population in college had disabilities, and in 2016, it had risen to 20%. Next slide. However, in spite of quite a few more people attending college, the labor force participation rate, the disparity between people with and without disabilities, remains high. Just a note very quickly on the bars and the graphs. We indicate folks with disabilities with a D, and folks without disabilities have no D in their in the slide. And if there's a significant difference, it's shown by a blue background for people with disabilities and a pink background for people without disabilities. So there is a disparity, particularly significant disparity within the ages of 18 to 64. 34% of people with disabilities are employed versus 78% for people without disabilities. When you shift to college age population, you're still seeing a disparity, but the disparity is less. 48% of people with disabilities are employed versus 81%. Next slide. So the research questions that we tried to answer in this survey was the extent to which college pays off for people with disabilities. And we also wanted to look at students with disabilities. Are they engaging in career preparation during college in ways that are like their peers without disabilities? And are they transitioning to work after they graduate? That is, individuals with disabilities. And how do the employment outcomes for recent college grads with and without disabilities compare? Next slide, please. Our sample included a little over 4,700 respondents from all 50 states, ages 20 to 35. And we wanted to survey folks that had graduated in the previous 5 years. Our population was about half men, half women, 2% non-binary or trans. 61% were white, 11% were black, 17% were Hispanic, and 35% of the population that we surveyed had annual household incomes of less than $45,000. Next slide. In terms of identifying respondents with disabilities, we had 10 items in order to identify individuals with disabilities. The first 6 items were the well-known questions that we borrowed from national surveys. And we asked for additional prompts were added to ensure that recent college graduates with disabilities were not being underrepresented. These prompts included items designed to capture learning disability, psychiatric mental health, or behavioral health disabilities, and intellectual and developmental disabilities. Next slide. Okay, Heather, can you go back one slide? I would just like to point out that it was interesting that the largest proportion of people in the sample had indicated that they had mental health disabilities. I think that's important. Next slide. Going forward. Okay, we're going to start by talking about or reviewing the results regarding the degrees that people got and from which institutions. Next slide. Just a note again that any significant differences between people with and without disabilities are indicated by a D in the bar. And there's no D in the bar for people without disabilities. And significant differences are indicated by a blue background and for people with disabilities, and a pink background for people without disabilities. There were as many people with and without disabilities who were graduating from, who had bachelor's degrees, and there were equal numbers who had advanced degrees. But there was significantly more people with disabilities were graduating with associate's degrees versus people without disabilities. Next slide. Reasons for people getting degrees from community colleges. People with disabilities indicated that they chose community colleges because they were more convenient to get to, easier in terms of transportation, closer. None of the other reasons showed significant differences. It was also true, our results showed that recent college graduates with disabilities were more likely ever took courses at a community college. That's 50% versus 44%. And that refers to taking community college courses while they were in high school or while they were getting their bachelor's degrees. Next slide. Okay, I'll hand it over to Elaine and Annemarie.
So what we want to do during this presentation is tie in some of the
survey data with actually real lived experience. And Anne-Marie is a young woman who self-identifies as having a disability. So we're going to kind of break up this presentation with a little bit of a question and answer and get her perspective on our survey results and her lived experience. So to start with, Anne-Marie, when you decided to pursue high school, higher education decision in high school, what was behind that decision?
A lot of what drove that decision was my, at the time, emphasis on that, at the time, chosen career path was to go into medicine. I wanted to become a physician to help people like myself. So I knew that a college plan needed to be in place in order to go to medical school. So that was initially what spurred this whole adventure.
Well, that's really ambitious for somebody with and without a disability. There's a lot of education, a lot to do. What was the
Yeah.
reaction of your guidance counselor when you told that person about your decision?
Yeah, I mean, at the time, for my guidance counselors, both my individual guidance counselor as well as the college career guidance counselor, because we also had that as well, um, it tracked. It made sense. I was doing very well academically, especially within the sciences and within the mathematics courses, which were going to be necessary for that, type of endeavor. So there wasn't any disparaging or discouraging from that goal. It was more of, okay, based on that goal, what programs are going to be best feasible and suitable for your needs. So that's kind of how that adventure started.
So your schooling, the people at school support, counselors were supportive. How about when you told your family? What was their reaction?
They knew that was something that was coming out of my mouth as a small child at like 4 or 5 years old. So this was a constant conversation that was always had. I was always going to be a doctor. I never saw myself doing anything else outside of that goal initially. So that wasn't really a shock for them at the time.
So you had the support of your family, you had the support of your guidance counselor. What was the reaction actually when you wanted to go to college? How did they help you decide, to be a physician or guide you towards that path?
That's a great question. So a lot of that actually came down to both the guidance counselor and the career counselor, the career college transitional counselor, of kind of saying, okay, what is your plan? Do you want to live at home and be going to school from a home base type of situation or a community base where it's very close to home? Do you want to move out and go live at a college campus? If so, where in the country do you want to go? And then based on that, we were looking at programs throughout the country. My family is very close knit. I live in New York. I've lived in New York all my life. Up until I went to college, I did go to college in New England. For me, that was a decision because I needed to be able to physically get home when I needed to. If I needed to reach out to my support system or see my family or my healthcare physicians for my own personal needs, I needed to be fairly close to home. I couldn't see doing that, going out to California or something like that, and that be a viable thing. So for me, that had a lot to do with it, and just choosing the best programs in my area.
So you wanted to find a school that met your needs and was kind of close to your family. Did you ever consider a 2-year school?
I'll be honest, no, I'd never considered a 2-year school. I hindsight now, may have regret that choice. Maybe it would have been a better situation for me, as my freshman year was a very tumultuous transition. Um, the benefit of doing the 2-year school, I find from speaking with a lot of my own students, is that it's kind of a breakup of going from the high school setting where you have all those supports in place. Now you're learning to self-advocate and navigate the college setting. For myself, I just kind of jumped into the 4-year, figuring, okay, I'm going to go to medical school. That's going to be like a 12-year process. So let me just get started. And that came with some back and forth overall. So
Which we'll talk about
yeah,
as we move forward with this as
sure.
well. Next slide, please. So we heard a little bit from Anne-Marie about her experience, and we just want to summarize this section on degrees and institution. Next slide, please. So we all know that earnings at a higher level of education for people with disabilities really do make a difference when you move, especially when you move from that high school level to the associate's level. There's really a proportional bump up. It's much greater even than students without disabilities moving from high school to an associate's degree. We see from 43% to 63%. And at each additional level that we'll see moving on, there is that proportional bump up we see in earnings and not. So a person with a disability continuing their education after high school really pays off. And that's what we saw as a result of some of our surveys. And when you think about it right now with COVID and high unemployment, it does make a lot of sense to continue your schooling because everything has moved virtually. So a lot of the barriers that were there for young adults with disabilities beforehand have virtually been eliminated in this COVID environment. Now we're going to dig a little bit deeper to what happens during college. John, back to you. Next slide.
Okay, now we're going to focus on college major. Next slide, please. Okay. The most popular major, the most common, was business management, and that was across the board. Unfortunately, students with disabilities were less frequently majoring in business. People with disabilities were majoring in health and related sciences to the same degree as students without disabilities. And then again, people with disabilities were majoring in STEM programs, that is science, technology, economics, and mathematics, to a lesser degree than students without disabilities. Next slide. In terms of college major and its impact on employment, we can see from this slide that students with disabilities who majored in health sciences versus other majors were less likely to be employed after graduation. However, students who majored in education versus other majors, students with disabilities, were more likely to be employed. We also see that the third most common major for students without disabilities is engineering, and those who majored in other areas like health sciences or general other degrees, that they weren't becoming employed as frequently as those who did major in computer science. Next slide. We also saw that in terms of those who had bachelor's degrees, that students with disabilities were less likely, or I'm sorry, were more likely to be in person-related helping professions versus students without disabilities. The reverse is true for those who are in STEM jobs. Those who majored in STEM jobs, people with disabilities were less likely to be employed in the STEM field after graduation. Next slide. We're going to take some summary points to remember. Next slide. I'm going to review those. I think the takeaway from this is that recent college graduates with disabilities are less likely to major in STEM and less likely to work in STEM. Among computer science majors, there's no increased likelihood of post-college employment for recent college graduates with disabilities, but there is for recent college graduates without disabilities. And I think this disparity is concerning as jobs in these high-tech fields continue to grow. It is more important than ever that college students with disabilities, if they're interested, actually major in STEM to prepare for the growing employment opportunities in areas like finance, accounting, software development, business analytics, research and development, etc. The good news is that nonprofit organizations such as Lime Connect are among the many organizations working to match recent college graduates with disabilities with STEM backgrounds into STEM jobs. And also, as employers diversify their workforce and become more inclusive, companies such as Northrop Grumman, SAP, and Microsoft are hiring recent college graduates with disabilities for their high technology career pathways. So this is some good news. Next slide. Career preparation. Career services used during college. The good news is that career services are being utilized at least to the same degree among students with disabilities as students without disabilities. So we're seeing that for participating in job fairs or recruitment on campus, resume or cover letter training, interview training, mock interviews, career explorations, and even people with disabilities are more likely to be taking advantage of career counselors while in college versus students without disabilities. Next slide. Also in academic advising, we also see parity, if not better outcomes for students with disabilities versus those without. So we see parity in terms of being assigned a faculty advisor or mentor. About 50% of both groups are taking advantage of that. We see parity in being assigned a peer advisor or mentor. And we see parity in informal peer advisor or mentor, having an informal peer advisor or mentor. And students with disabilities are more likely to take advantage of the Academic Advising Center. And they are also more likely to have an informal faculty advisor or mentor. The one caveat to that is that that they're not as satisfied with the career advising that they're getting, and they're not as satisfied with the assistance that they're getting in that area, as well as the other career activities that happen at the college. Next slide, please. Impact on services. What impact does the college services that students with disabilities participate in? And if they participate, students with disabilities, in accessibility services, academic advising, or career services, they're more likely to be employed after graduation. Next slide. In terms of internships and their impact on employment, and this is true for students with and without disabilities, they are significantly more likely to be currently employed if people with disabilities, as well as people without disabilities, if they take advantage of internships. Next slide. Also, the impact of employment, that is, while working during college and the impact on employment, we find that there's a significant bump up for people with disabilities and for people without disabilities if they were currently employed during college. So what works for one group works also for the other. Next slide, please. Okay, back to Elaine.
Okay. Thank you, John. So we just heard from John about all the things that students may take advantage of during school and how they do that. And I wanted to just chat with Annemarie again to see about her experiences during college. So Annemarie, how did you first learn about the career and disability services that were on campus at Fairfield University?
So Elaine, that's a really great question. And to connect it back to our earliest part of the presentation, that was part of career planning from the high school, the transitional level. We were always encouraged to go out to the schools, visit the schools prior to applying, really get to know the services that were available on campus. And that's exactly what I, with a few of my family members, did do. We scheduled an appointment to go on a campus tour. And we also scheduled an appointment to meet with the Academic Disability Resources Center at the university, which was also housed right next to career planning. So you kind of got to meet all of the staff at once. It was incredibly insightful because then you could have a real logistical understanding of, okay, this is the physical campus. What are the resources that this campus can offer me throughout my academic career? So it really helped paint a clear picture.
That's great. So you knew when you're going to school that you already had some familiarity with the career offices and disability services offices. When you actually got on campus, though, what did you find yourself using as a student?
So that's a really great question. Initially, when I first started freshman year, just going through using my academic accommodations, but as things wore on and I was kind of challenged with deciding whether or not biology as a major was the major for me, I came to understand, you know what, this is not a viable career for me. I don't like doing this anymore. I don't know if I want to go to medical school. So I reached out to my advisor at the time within my department, so within the bio department. They encouraged me, along with an English professor of mine, to go, meet career services, sit down and take an assessment or two. And I met with the career counselor there and I said, kind of having a crisis of faith, what do I do? And they were like, let's kind of help you figure out where you're at. Um, we did a few assessments and then I sat down and really discussed with them what the options were based on those assessments and what I was feeling at the moment to then make the necessary changes with the college major. So I changed my major from being bio pre-med to going into English with the hopes of actually going into education initially.
Well, that's great. So you were able to use the services on campus while you're in school to not waste so much time and get the right credentials you needed in order to graduate with a major in English. What were some of the biggest barriers, though, you faced while in college?
So the biggest barrier for me was, quite frankly, me. I had to understand, coming from, the high school situation and scenario where everything was kind of provided for me and I had that comfort of that support, to now learning how to support myself and what that looks like compared to my peers. So that may include, or not be limited just to, the physical barriers of ambulating the campus. I do have cerebral palsy, so that was a challenge on campus initially. And then also just learning within my own self what I wanted to do and not necessarily putting myself into just one box and kind of looking at it in a much broader perspective.
I think that's sometimes for both students with and without disabilities, you tend to sometimes see yourself as your own biggest obstacle, whether it's trying to decide what you want to do or where you want to go to school. And I think that's really important to share because you need to find the right supports on campus to help you get through those times when you just need a little bit more assistance, and you did find that career services really helped you. That was great. We're going to go on and just kind of summarize this section. So can we have the next slide, please? So to summarize just the career preparation during college, next slide. You know, it's really hearing from Annemarie, hearing about our survey. What's really exciting about our survey is that it really counters the long-standing myths that we have about young adults with disabilities attending school. Excuse me. When it comes to engaging in career preparation activities, we saw that students with disabilities really engaged in these activities the same as students without disabilities. They took advantage of the career services on campus, whether it was seeking out career guidance, as you heard from Annemarie, the career office connections, which at her school happened to be co-located, which is really kind of the best practice moving forward. Whether students engaged in part-time activities, volunteer activities with the help of these offices, it can really make a difference in successful employment after college. What may be the more surprising finding from this study is that recent college graduates engaged in these type of career preparation activities as much as their peers. Next slide, please. Next slide. Great. Okay, so I'm sorry, I'll go back one. So as we heard, you know, it really is nice to have those college offices co-located, and that's usually not the case because sometimes the career offices are in places that are not accessible. They may not know what kind of accommodations individuals with disabilities may need. So it really is nice to hear that we do have some schools that do co-locate these services. In 2013, Kessler Foundation launched a program called Bridging the Gap, and it was done by San Diego State University along with the University of California, Berkeley, and Cal State Fullerton. And what that was is actually the first college curriculum per credit that was launched, and it had wraparound services of business mentorship, career mentorship, internships, and job search. And we did find that when all those services were together, in a package, if you will, for students with disabilities, there was a lot more success in the workplace, and it resulted in higher placement and starting salaries in other programs. Next slide, back to John.
Okay. Now we're going to review working after college and the influence that college had on employment after you got a college degree. We had anticipated or heard through, you know, through the field that many people felt that that individuals with disabilities were not getting equal opportunity to be employed after getting a college degree, and our survey was our survey showed, however, that those results are not accurate. There was no difference between students with and without disabilities in terms of whether they were currently working or not. There was no difference in terms of whether people with disabilities or without disabilities worked in the past. They may not be working currently during the survey, but they had worked since graduation. And it was also interesting to note that there were more people with disabilities who had worked in the past, not since graduation, than people without disabilities. Next slide. Now that we're looking at kind of the nature of the work that people were doing, where they were working, and there was a significant difference between people with disabilities and without disabilities in terms of working in the private for-profit sector. There were more individuals without disabilities who were working in that sector versus people with disabilities. There was an equal proportion that were working in government. There was an equal proportion that were self-employed. And however, there were more people with disabilities working in the nonprofit world versus individuals without disabilities. Next slide. Also, working arrangement. As we begin to drill down a little bit, we're beginning to see some disparities. There were more people without disabilities who had regular permanent positions, whereas there were more people with disabilities who were working as consultants, freelancers, intermittently on call, or had working for temporary agencies. Next slide. In terms of the top 5 job categories, many of the categories were the same in terms of health, engineering, sales, and marketing. However, there were the top 5 job categories for people without disabilities included computer-related jobs, whereas it didn't in the for the folks with disabilities. And also the folks with disabilities were working in clerical or management type jobs, which were not in the top 5 for people without disabilities. Next slide. Also, we saw that people with disabilities were more likely to be in terms of hourly wage, they were more likely to be in the lower levels of hourly wage versus people without disabilities were more likely to be in the higher levels of hourly wage. Next slide. We also asked individuals who were not employed and were looking for work. We also asked them, and that included people with and without disabilities. We also asked them what the barriers were. And the significant differences between people with and without disabilities is that in terms of barriers is that people with disabilities assume that employers would assume that they couldn't do the job. People with disabilities were also assuming or concerned about getting less pay than others. And people with disabilities were also more concerned about negative employer attitudes than people without disabilities. Next slide. Elaine, over to you.
Okay, so now we get to the fun part of the discussion. So we've actually made it through school, and now we're going to go into the workplace. I know you mentioned earlier that you switched from medicine to writing. What was your experience like? You finally got your diploma in hand. You're excited. You're ready to go get that job. What was it like?
It was very challenging. I think challenging is the best word. Utilizing all of those resources, the career planning, the mentors, the internships, all of the work experience. I pounded the pavement like my colleagues that were, not disabled, starting that January leading up into graduation that final year, and just was not getting anywhere. And it was very unfortunate. And what actually happened was graduating and going through that first summer post grad and kind of trying to figure out, okay, well, where can I get a job? And I had actually, very similarly to the study, ended up landing somewhat of a temporary job as a freelancer, but knew that the money wasn't there. So I'd end up having to get another job to supplement that income, really struggling. And ended up, unfortunately, working. It is a positive and a negative. I ended up working in the retail sector for quite a while, but that time working in retail and making the connections I had made outside of that connected me to state vocational rehabilitation services, which helped me kind of reevaluate and reassess now, okay, well, what is your skill set based on your degree? What was your original plan? What is the current labor board statistics showing me? Is there going to be work for me in the education sector? We've had conversations. I had a conversation with my vocational rehabilitation counselor about that, and they were kind of very hesitant. Understandably so. Working in higher education, there isn't necessarily always a safety net. There's certain things you would have to put in place to make sure you're working on a regular basis. So then, working in retail is having somewhat of an income coming in. It was a reestablishment of, okay, you completed your 4-year degree. That degree is helpful, but we need to get you into somewhere where you can kind of thrive. So we then pursued the master's education in counseling, and here I am before all of you now. And that was a huge jump for me. Again, reassessing, my own personal hangups of, well, I wanted to be a teacher and I wanted to be a writer and do these things and wanting to help people. Now I get to help people in a very different way, but in a very fulfilling way. So that was an incredibly important step. I think had I not tapped into those services, I may not be sitting with you right now, and I may still have been working in retail. Not that retail wasn't a fine position, it was decent, but going back to the to the studies statistics, lower income wages, issues with wondering if my employer can see me doing this job well enough. With retail comes high turnover rates, so it's constantly needing to prove yourself to your employer that you're a valued member of the company to be considered for other things. So that's very much a challenge for a person with a disability, at least in my case. I don't want to speak for the whole population, but statistics are kind of supporting me there.
And I think too, if you look at what's happening now in the economy with COVID, our survey showed that a lot of individual with disabilities chose gig work to do piecemeal. I mean, that whole area now is really hurting for both people with and without disabilities. So let's talk a little bit about so you landed in rehab counseling. You're now the coordinator of disability services. What kinds of questions you get from students, and how are you able to answer them using your experience so that you can really provide more of a rich lived experience to all the questions you come? So what comes across your desk?
So there's quite a number of things. Going back to the students thinking about coming to our university, right? I field a lot of those questions every day, and I get a lot of parent calls, actual students calling and asking, what services do you provide? What services are available to a student with a disability? What if I don't know if I have a disability, or how can I show that to you? So really, reassuring persons what is available to them, what the resources are on campus, but then also helping them to navigate, it doesn't matter if you're coming to SVA or not. These are certain things you need to have in place. If you don't have a history of accommodations, you may need to be assessed. Most colleges will require, when a student files for accommodation requests, there needs to be some form of documentation. So whether that's coming from a care provider, or if the student was in an IEP or 504 plan within their school, you need copies of that documentation to establish what's going on with that student so they could be further supported. And unfortunately, not all schools provide that little nugget of wisdom of like, oh, I can have accommodations in the college field. Really? Okay, great. And then taking that, and now with my upperclassmen, and saying, okay, you've been with us now 2-3 years. What is your thought process with getting a career? What are your concerns about going on that interview, for example? I get a lot of students asking, well, should I disclose? When should I disclose? I said, that's a personal choice. I said, personally for me, I waited to disclose until the offer came across my desk, and then I would have that discussion about what would I need, if anything. And really just working, our department will partner with our career services on our campus as well, and we have a very good symbiotic relationship with them. And we just encourage students to ask the questions. Don't be shy to ask questions. Don't be shy to feel if you need help, say you need help. It's better to get the resources to you now versus having to be out on your own and trying to piecemeal those things together as an adult with no
Mhm.
formal supports in place.
It sounds like you would recommend then somebody with a disability going into the counseling field, that they really can help other peers, help others with their experiences to really direct them the right way without having to be a little wishy-washy, where maybe somebody who doesn't know that much about disability can direct somebody.
Right. And I
So
don't I'm sorry to cut you off. I think any
no,
person
go ahead.
any person with a disability should be able to go into whatever field that they want to. I support that, because we need those people to then connect further generations of people with disabilities, that if they want to go into that STEM program, let's peer connect them with that person, versus everyone kind of falling into just one or two sectors of the work environment. We just have to kind of work together to make sure those other sectors are just as accessible for people with disabilities, depending on what
Right.
their needs are.
Right. And people get the right advice. This is what you're talking about.
Exactly.
Looking back on the survey, what would you say were the most, which findings were most meaningful to you?
I think the findings that were most meaningful to me, while we can't give it exactly a causationary effect, but seeing all the different factors correlate, right? Having the appropriate pre-college transitional services in place, asking those questions, getting those supports in place, reaching out to career services, having a mentor or mentors on your campus or outside within the community of that campus, and gaining that internship experience is super invaluable to a person with a disability, especially like the research says, often employers will assume the person cannot do this job because of, disability X. But by the student saying, look, here's all of my experience, and here are people you can call and talk to, having those things in place really will, I think, speed up the whole overall process for that person to become employed and have their independence.
Mm-hmm. And what did you think was the most surprising to you, given your personal experience and professional experience in the field?
I think the most surprising thing was that many people with disabilities were not kind of happy with their career placement services, like on campus, and that kind of counseling situation. I think that shows there's a large opportunity for counselors, students and counselors alike, to educate each other, and making career counselors especially more aware of the needs of a person with a disability, and that we need to be also fostering that education as well, so that these students are well prepared of that college transition jump into the working sector.
Yeah, that's so important, to make sure that you're not just going to school and then you're getting out and not knowing what to do, and being left stranded, which
Exactly.
to your earlier point, you want to make sure that career service and disability services really help with not only what's going on in school, but help move, provide some guidance to what's happening after school. So let's just sum up this section. Can we have the next slide, please? So some of the points to remember after going to school. Next slide. Next slide. We've talked about the rate of unemployment increases at each higher level of education that you get for people with disabilities, that it's increases at a higher rate actually than people without disabilities. So for example, again, if you're moving from an AA degree, associate's degree, to a bachelor's degree, we see almost a 20% improvement for a person with a disability. And as you can see here, college does pay off for people with disabilities, and 90% of the recent college graduates that we saw through our survey did hold jobs after graduation. Next slide, please. And although there's traditionally been a disparity between employment for people with disabilities and with the general population, we know people with disabilities want to work. And the ultimate objective is really to identify the innovative ways to help people with disabilities strive to work and overcome the obstacles to employment. In 2015, Kessler Foundation engaged in another national survey that was on employment. And what we found there is that individuals are really striving to work in all different kinds of ways, whether they were taking courses in education, they were looking for jobs, they were at the job and looking for promotion. But more importantly, over and over again, we saw that people with disabilities want to work. And by offering new information and data to the field through this survey and some of the other surveys we've done, it really allows an opportunity to provide new priorities and policies and programs to increase the participation rate of people with disabilities in their workplace. We hope that all the information that we've provided today will be helpful for individuals and families, but most important for those individuals, transition counselors, counselors in college, who really assist individuals with disabilities in their career planning to recognize that education pays off in earnings and in jobs, and enables people to be more self-sufficient in our communities. Just a last note, what COVID has done is really leveled the playing field in a lot of aspects, because now accommodations for work are working virtually used to be an accommodation. Now a lot, that's become the mainstream. Some of the transportation barriers aren't there anymore. So really, what Annemarie said, if you do have issues with, being your own worst enemy sometimes, which is staying motivated, making yourself go out and do it, get the assistance you need and the counseling you need from a variety of sources, whether that's through your school community or through your community at large. Before we have Q&A, I'm going to ask everybody to maybe have a minute or two to just wrap up on some last thoughts. John?
One last thought, that I didn't present this result, but when students do internships, they're more likely, while in college, they're more likely to be employed after graduation. However, the real bump up is if students do internships while they're in college and they're in the fields that they're majoring in. Over 90% are employed after college. So it's even if you're in the field you're majoring in and you're doing an internship, it makes a big difference.
Annemarie?
I think final thoughts is whomever you're supporting, that person with the disability, or if that person is you, I think it's important to field all of your resources, whether it's from your high school counselors, your college counselors, or reaching out to state vocational rehabilitation services, agencies, nonprofits. Really see what's out there for yourself to help assist yourself overall throughout the entire education to work transition.
Well, we do have a few more minutes, and let me ask Annemarie and John a few more questions. So John, as a researcher, how do you see this work that we've done influencing the field out there?
I think there are opportunities for great improvements in terms of the quality of the jobs that people with disabilities are obtaining, and particularly within the STEM fields. And I think there's quite a bit of work to be done amongst students with disabilities who want to major in STEM and to pursue careers in STEM. I think that there are probably some activities, some of the research has supported this in the past, but providing opportunities for students who are majoring in STEM in order to have mentors and advisors who are in the fields that they're interested in, and to have internships and summer experiences within companies and corporations that are hiring people with STEM can make a big difference in terms of developing one's social capital or connections, which oftentimes students without disabilities may not have to such a natural degree as students without. So I think there are great opportunities there to improve the outcomes.
Yes, I think STEM really does make a big difference. We see a lot of jobs now are in the STEM field. I think technology jobs where you do need math and science backgrounds are going to take off with what's going on with COVID. I think that's really important. I know before we started, Annemarie was sharing some stories about how this presentation was so timely because she frequently gets calls from counselors and transition counselors, as well as on the college and high school level. And Marie, share a little bit about some of your conversations you had this week with the phone call you got.
Great point. Counselors this week, a lot of them are very confused as to how does the student go about getting those accommodations. So it's really kind of a guidancing kind of question. So if you are an educator, a family member, the person themselves, if you're interested in a particular institution, it's going to be important to get to know what that institution's protocols are for applying for services. So I would, advise counselors for our particular process, student has to self-identify through a registration form online, which is accessible. And then they need to provide supporting documentation for, those accommodations, especially if a student has had accommodations in the past. It's important to reach out and see if those services can be provided as a further support. Maybe that student may not need those supports at this level or depending on the course, but those, supports can be available for the student if they need to. And the other thing is, for many students, is a challenge of having appropriate documentation or updated documentation. I know for especially higher level degrees, master's degrees, doctoral degrees, if you have to take any standardized testing for those applications, oftentimes when submitting for accommodations, those boards don't want those documents more than 5 years old. So that could be a financial challenge for many students coming from lower socioeconomic statuses, much to what the presentation pointed to is many students are coming from a low, mean, or median income of under $45,000. Some neuropsych evaluations can cost $8,000 to $9,000. So it's important to make sure if that's something that's needed, maybe the schools can either provide support or connect that student to out-based community services. I know a lot of universities always check out the universities and see what programs are offering, because often that's part of doctoral training. The student can get that at a decent discount, or even through vocational rehabilitation services. A lot of the times, if that's something that's needed for that student to pursue the goal of education for a job or a specific career, they will pay for those services. So it's just very important to make sure people are aware of what resources are within their own communities.
We do
I
have
think that's a
one.
really important point.
Yeah, I was just going to say, we do have one comment from Jessica. Quote, "I'm an educator, and it was helpful that it was mentioned that employers tend to think a person with a disability cannot do the job. Job shadowing, internships, and helping a student develop a resume is a great plus." So, and she said, thanks.
Yeah. I was going to mention that, especially because I think sometimes it's not what Annemarie has seen through her experience. Her counselor in high school was supportive, her family was supportive, but what we've also seen, and I've had this discussion this week with some professionals in the field, is that the attitudes of families and transition counselors in high school are not that encouraging for students to pursue their education. And when you really think about it, whether you're a student with or without a disability, a lot of students in high school didn't do well, but when they went on to either a trade school or higher education, they did really well. And then you have the opposite. You have students who do really well in high school and may completely fall apart. So I think it's important. And right before COVID, we did see through the National Trends in Disability Employment Report that Kessler puts out with the University of Hampshire, that jobs had started to really climb again for people with disabilities, their participation rates in employment compared to the dip we saw in 2008. And employers were interested in putting disability as part of the diversity. But part of that equation is also really having everybody who's that whole world around that individual with disability really believing in their abilities and giving them the dreams. Annemarie, do you want to comment on that?
Absolutely. I think it's really important to support the dreams, but also to support, it's okay to fail too. Oftentimes, college for
Mhm.
persons with and without disabilities, it's a learning curve. What you were good at in high school is not necessarily what you're going to be the best at in the college, arena. So it's learning to be supportive of the dreams and the change of those dreams as time progresses for that person. And I think
Mhm.
that's the most important thing overall. We all learn but through our failures more so than our successes.
And John, I know, with your other hat, you actually are an educator to teach young college students who are pursuing advanced degree in counseling. What are your comments on this?
Well, I think Anne-Marie is correct. You never want to rain on somebody's aspirations. That's a sure, that's a sure to be a mistake. And I think we make a lot of assumptions about people with disabilities, unconsciously many times, that are just false and not true. So I try and encourage my students who happen to be getting graduate degrees in rehabilitation counseling to take a very person-centered approach and to support people's aspirations and dreams. Um, I think that is critical.
Yeah, it is critical. And I think going back to our survey, this is what we saw is that, students with disabilities are using higher education starting first, taking some courses in college at those 2-year schools and using the 2-year schools as an entree into the world of kind of tasting and using that experience to get them higher education. I do think that at least in New Jersey, there is a program here that which is where John and I are, and Anne Marie's in New York. If you go to a 2-year school and you do well, you are automatically eligible to get into a 4-year college. So it really does bode well, both on the expense side and the trial education side, to do that. It doesn't look like we have any other questions. So I think what we're going to do is just maybe have one more round of wrap up and see if Anne Marie or John has any other comments. And then I think we're going to close. Do either of you have anything you'd like to add to our discussion?
John, do you want to go first?
Okay.
You go first, Anne-Marie.
Okay. To build off of your other point that you just made, which is so eloquent in really focusing on the person, it's incredibly important to focus on the person, but it's also incredibly important to be realistic with that person and say, you know what, we are going to support you with this aspiration. And if something doesn't work out, let's work on retooling that so that you can be satisfied with what you're doing. And oftentimes, going back to your previous point about how we have these presumed attitudes of, that are just completely false. It's also important to be really honest and forthcoming with our students and, make them very much aware of their strengths and where their weaknesses are so that they're not over devoting any energy to something that may not serve them. And I think that's also incredibly important as well.
Good point. Mhm.
Okay, I don't think I have much more to add. There is one more comment from Richard. He says, I think it's great how Anne-Marie has overcome many barriers to help students.
Well, thank you all. We really enjoyed sharing our work with you today. And I think if you go to the next slide, we do have our email addresses, contact information that we're happy to follow up with you if you have any additional questions.